Good day and welcome to the Bipartisan Policy Center's webinar, Creating an Integrated, Efficient Early Care and Education System. Today's conference is being recorded. If you would like to ask a question, please type your question into the question box at any time during the presentation. At this time, I would like to turn the conference over to Linda Smith, Director of BPC's Early Childhood Initiative. Please go ahead.
Okay, well thank you, and I want to welcome everyone to the webinar today.
Sorry, I'm trying to get it.
I think we're still trying to get the slides up on the screen here. Hang on just a second.
Trying to share it.
Okay, so I'm going to get started with the introduction while we try to figure out the technology here. As most of you know, my name is Linda Smith, and I am the Director of Early Childhood here at the Bipartisan Policy Center in Washington, D.C. And today what we are doing is releasing our report that examines the alignment and coordination of early care and education programs, beginning with the roles of Congress in this issue, moving on into the federal agencies, and then down into the states. And what we wanted to do here was answer one of the old questions that have been hanging around for a long time about this issue of fragmentation, overlap, and duplication of programs and funding out there in the states, and the degree to which this influences what happens with families on the ground. Before we get started, I want to acknowledge the efforts of many people here at BPC who worked on this, as well as our consultants. Of course, Arabella Pluto-Ehlers, who is the assistant here, was probably the key person in all of this, managing all of the back and forth with the states and everyone else. I wanted to give a special shout out to her. Sarah Tracy, who's on the staff here, and Megan Campbell, who just started, and welcome Megan. And then our consultants, Moushami Sarkar and Grace Reef and Chantel Meek, who all worked very hard on this report, and I hope that you see that work as we get through this conversation today. And then a special shout out to the Heising Simon Foundation and Rebecca Gomez, who funded this project. I want to get started by just explaining that this report is based on some assumptions that we made here, and we think they're pretty strong in the sense that we believe better program and alignment and coordination leads to better outcomes for children and families, and it affects how families get services, it ensures public accountability for funds, and it basically impacts the quality of services that families receive. So with those assumptions in mind, we're going to go on, and here's what this report looks at. Basically, we'll discuss what we think is the problem, why we did the report, what we did, how we compared the states, then look at the top 10 and bottom, recommendations and our conclusions from this. And I think when we get through this, you'll see that there's a lot of room over the coming months and years for improvements in the early care and education system at the state. I want to go to the next slide and take a look at it. I will tell you that this work started as a result of a visit that I made several years ago to watch a family apply for childcare subsidies. And it was quite mind-boggling to me what I witnessed in terms of the family's experience. And I'm not going to go into the details on that, but suffice it to say that as we defined the problem here, we really did consider what a family was experiencing as they tried to get through whatever systems are out there in the states. And what do they have to endure to get early care and education services for their families? We want to keep in mind that for families, like many of the low-income families we're talking about, this is a real hardship when they have to go to multiple programs scattered around town with different requirements. And you see in the sidebar box on this slide that these programs can present multiple requirements and eligibility processes, etc. And all this is really a hardship on our families. So as we go through this, I want people to keep in mind at the end of the day, that's what we're trying to do here and who we are really looking at. So if we go on to the next slide, why did we do this report? Well, every year we know Congress invests billions of dollars each year in these programs for children under age 5. Additionally, the states are putting a lot of money into pre-K around the country and using their own resources. But as a matter of history now, several reports have been done over many years by the General Accounting Office in response to Congress, who has asked the question about duplication, fragmentation, and overlap repeatedly. And this has gone on since 1994 when the first report was issued by GAO up until late last year in 2017 when they issued another update. The question that we had to ask in doing this work was, GAO looked at the federal government in terms of overlap, but because so many of these funds go to the states and with considerable flexibility, no one has really looked at how the states interpret and how the states organize these programs. And so there's been for many years, as some of you know, kind of finger pointing back and forth of the states saying the problems are Washington, D.C., and Congress or the federal government, and the federal government saying the states have flexibility, why aren't they using it? And so we set out to try and understand exactly what was going on. And we're going to go over what we found. But the one thing I will point out at the beginning of this briefing is that with only one exception did we find that Congress actually specifies where the money goes in a state, and that is Part B of IDEA. In all other cases, the placement and administration of these programs is up to the state and the governor. So I think with that said, it sets the stage for what we decided to look at here. Then the next slide, I want to put it out there and be clear on this at the beginning of this, that in no way are we suggesting that there is enough money in early care and education in this country to meet the needs of our families. For example, in this report came out in another report by GAO that we're only meeting 11% of the eligible need for federally eligible children. And this was using 2012 data, and we do think things have changed, but not that much since then. And the fact is that we have a long ways to go on funding. That said, it does not mean that we can't be more efficient and effective with this money. So the next thing I just wanted to put out there and remind everyone was how the General Accountability Office actually defines their terms. And in terms of fragmentation, basically the key words in here are administered through multiple agencies, which we looked at in this. Then in terms of overlap, that they target similar beneficiaries. Well, there is a fair amount of overlap in these programs just by the nature of what they're designed to do. And then duplication, fund similar types of services for similar populations and with different eligibility requirements and data limitations. And I think that this is where we have some very strong recommendations for Congress, and there are some things that can be done there. So what does this report cover? Well, it really looks at the 50 states and the District of Columbia and the organization of early care and education programs within the government, the state government structure. We basically looked at a number of different things, and we're going to go into those. But again, restating the fact that the governors have flexibility in determining where these programs go. So here's what we looked at. We looked at total federal and state funds spent on early care and education in the state, how the states are responding to the federal requirements, including requirements in the various authorizing statutes, the number of state agencies and divisions within state agencies involved in administering these programs, the location of related programs, and we'll talk about that, state advisory councils and where the council is housed, the placement of the Head Start Collab office, the integration of early childhood data systems across programs, and then the implementation of QRIS systems. So what we basically did was started with the 9 funding streams that GAO identified in their 2017 GAO report. And we added in 2 other funding streams because they contribute so much money to early care and education, those being Tanf, excuse me, and the Child and Adult Care Food Program. And then the last thing that we did when we looked at the reviewed programs, we dropped those programs that were in the GAO report that were either competitive grants or were not available to all states. Excuse me. So those that we dropped from our review that were in the GAO report were Striving Readers, the Campus Program, Promise Neighborhoods, the Preschool Development Grants, Race to the Top, and then also the Early Head Start Childcare Partnerships. We did take a look at those where they were in state agencies. So before we go on, I want to just describe how we conducted the study a little bit before we get into the scoring. As I said, we started with the authorizing language from each of the federal funding streams and looked at where these went into the federal agencies to see if there were restrictions placed on them at the federal agency level. Then we followed those, as I said, into the states. We got our data from publicly available sources, and so we looked at state websites, at what they had out there on their administration, etc. Once we had all of that done, we provided the results to state personnel for review. And we did ask them to verify their data or what we had, and or we changed what they had as necessary. And I will say, and we'll note later, 50 of the 51 states verified their information. So just put that out there. So what were the major funding streams that we looked at that we considered to be, obviously the most important? At the federal level, most ECE, as we said, flows through the Department of Health and Human Services, including the Childcare Development Block Grant and Head Start. Those are two of the big ones. Together, those two programs provide 90% of the federal money going out to the states for ECE, and this chart shows how much in 2018. And again, we were very excited and happy and grateful to Congress for the increase in the appropriations for this money. In addition, as I said earlier, the majority of states are investing significantly in state pre-K for 3- and 4-year-olds. And at the end of the day, these programs all aim to do one thing, and that's provide our children with safe, enriching environments where they can grow and learn. So the next chart looks at the funding by the different programs, and I'm not going to go over this. I think many people have seen these numbers before. I do think that the one thing I would point out on this chart, and the one thing that I think people are very interested in, is how many children are served by this money, and the answer is we really can't tell. And that's because we know we have duplicative counts in some of these things, and there's no way at this time to really sort out, the numbers. So while we know we're serving a lot of children, we don't know exactly how many unduplicated children are being served by the programs. The next thing that we looked at was Tanf, because as we all know, Tanf plays a major role in child care funding. And we looked at states who transfer Tanf into child care and those states that spend an unlimited amount directly on child care. And so we were interested in that, and interested in it because we are very much concerned that those TANF funds spent directly, there's almost no way of knowing how many children are served by that, or the quality, or anything else that goes along with it. So while some people may argue this point, it's been our position here at BPC that money should be transferred in and comply with the Ccdf requirements. On this slide, it shows how many of the states transferred in 25% more of their TANF into Ccdf, and how many in the various categories, as you can see. And then in terms of, there are several states that actually have state policies on this that do not transfer because they have policies on that. On the next chart, looking at the unspent child care and development funds, We wanted to call this out because we think this is a big concern when states do not draw down all of their CCDF money, and we did rank them on this. In the state 2016 in question, 4 states did not draw down all of their funds. Those states were Idaho, Kansas, Michigan, and Tennessee. They returned about $27 million of CCDF funds, and I'm sure that all of the other states were grateful for that because that was redistributed to other states. But the point we're trying to make here is when the money is available, we certainly want governors and people in the states to be looking at this and encouraged to draw it down when it's available. So next we're going to talk about the state organization of early care and education programs and what we considered. So first of all, we considered the number of agencies involved in administering core programs, and we'll talk about those in a minute. We looked at if the CCDF funds were split between agencies when it came to subsidies versus quality dollars. We looked at the location of CCDF, CACFP, and state pre-K, if those were grouped together. We looked at the location of the Head Start Collab offices because one of the critical pieces of this is that as Head Start is a federal to local program, those Collab offices are supposed to be coordinating those activities within the state. And so if they're not located in the same place as the other programs, that's questionable as to whether or not that is happening. We looked at the QRIS intersection with state licensing, with the state advisory councils, their placement as well as whether or not they existed. And finally, we gave bonus points for pre-K, state funds, Head Start, Early Head Start partnerships, and Tanf transfer. So if we take a look at the next chart, you will see the number of states where 3 or more agencies are involved in administering ECE programs. And if you look at this, this is where we think the confusion starts. The more agencies involved in administering this money, the harder it is, I should say, the harder it is to coordinate and make sure that these things are not competing and or are not in conflict with each other. So when you look at this state, you can see that 29 of them were in 3 or more agencies. If you go to the next slide, you'll see where the highest concentration of programs are within agencies. And the darker the color, the more programs were administered together. So you can see that in those states, and you'll see here soon, the states that scored the highest in the top 10 are going to be in the darker shaded states, and that's because their programs are co-located within fewer agencies. So on the next slide, we want to talk about the placement of the Head Start Collab office because, as I said, this is an important, in our opinion, an important office within the states, and the degree to which it is co-located with Childcare and state pre-K matters to how well it can do the business that it says. So when the Collab office is co-located with CCDF and state pre-K, with both of them, those 3 programs are together, that's in 17 states and DC. That, in our view, is the ideal location for those offices. Then we looked at the number who were co-located with Childcare, but not state pre-K, and that was in 10 states. And this is an issue because if Head Start families need wraparound childcare services, it gets very complicated for them to manage that process if these programs are together or not. And then finally, where state pre-K in Head Start or Collab offices are together but not CCDF, and you see that there in 11 states. I will tell you that we were not able to determine from any publicly available resources how the Head Start Collab office's activities compared to the federal statutory requirements, and we actually make a recommendation to this in our recommendations to Congress. On the next slide, we talk about the placement of the state advisory councils, the SACs. In 45 states and DC, they have established state advisory councils based on the 2016-2018 state plans. That's where we got that information from. 5 states do not have SACs, and they're shown there: Florida, Idaho, Kansas, South Dakota, and Texas. And this is something that we think is important in managing these programs, and so we did take a look at where those were placed. The next thing we looked at were quality rating improvement systems. In most states, quality rating improvement system is a voluntary system. We looked at the degree to which states connected the QRIS to the state licensing, and that happens in only a handful of states, as you can see from the chart here. There are 3 states right now that don't have a quality rating improvement system: South Dakota, Wyoming, and Louisiana. That's what we could find from the sources we looked at. So now let's move on to comparing the states' ECE administration and how we did this. If you go on to the next slide, you'll see how we scored the states. We scored the states we gave a base point and bonus scores. There were a total of 50 points available in the base and 20 in the bonus. And if you look at it, the higher scores went to states with fewer agencies administering ECE, not splitting the administration of programs across agencies, Ccdf, subsidy, and quality. In particular, transferring of Tanf funds into Childcare, whether or not Childcare Development Fund, State Pre-K, and CACFP were in the same agency, requiring providers to serving children on subsidy to participate in QRIS, and functioning SACs. And I want to go back and just mention that in terms of the Ccdf, Pre-K, and CACFP, we looked at these programs in particular because they also have evaluation requirements with them. And when those programs are not co-located or not coordinating, providers can be hit with multiple, evaluations, inspections, and sometimes contradictory requirements. So we think this is an important area that states should begin to focus on and look at this overlap and this duplication there. So on the next chart, we look at the base score and scoring items and what we looked at, the number of agencies involved in administering core programs, Ccdf, subsidy, and quality, as I said, the location of Ccdf, Pre-K, and CACFP, Head Start collab offices with Ccdf or state Pre-K, the quality rating improvement system, and then whether or not they had a functioning SAC. Then we gave bonus points, and these were split evenly between whether or not the state was spending its own money on Pre-K, if the state added money to Head Start or Early Head Start, if the state had the Early Head Start Childcare Partnership Grant, the state, and whether or not the state transfers money into early care and education. And then finally, I will say we subtracted points from those states that did not draw down all their money. We took that very seriously and think that we needed to shine a light on that. So on the next chart, you see the top 10 states, and a shout out, we're sitting here in the District of Columbia, and a shout out goes to DC and Maryland as the top scoring states. In the top 10 states, the governors have really made an attempt to look at this seriously, to coordinate these programs, and you see the results on these scores. I think the one thing that we can say about this, and we were very, happy to see that this is not a red state or a blue state issue. It really was scattered across different states in different parts of the country. But all of these states have made efforts to really align their programs at the state level, and they deserve a big shout out for that. The bottom states are shown on the next chart, and these are states where there's multiple agencies in 2 of these states. There are 5 agencies administering programs, and as far as parents are concerned, that has to be causing confusion. We don't see any way that can really be efficient when it comes to what happens and how that translates into public services. 2 of the states in the bottom did not draw down other money, Kansas and Idaho. And 2 of the states, Arizona and Nevada, split their child care subsidy dollars and their quality dollars. So we were concerned about that. So if you compare the top and the lowest ranking states, this is what it looked like. As I said, the subsidy split in 2 states. The CACFP, if you look how many of the top states housed all 3 of them together with Ccdf and pre-K. The location of the Head Start collab offices, as we said, was important. A functioning state advisory council, all of the top states had that. The states, as we said, did not draw down their money. Statewide QRIS systems. You see the rankings there and how they compared, and so the top to the bottom. So what does all this mean for us? And I should note that you can go on our website and you can look at each state's sheets, and it'll explain how the rankings in each of the states matters and what we did there. But what we did next was take a look at all of this and try to figure out what are the recommendations that we think could matter at the state, the federal, and to Congress. So when it comes to governors, the standout that we're recommending in this report is that governors appoint an independent review board to look at the administration of these funds in the states. And we say that because sometimes bureaucracies can become immovable objects. And when you have a vested interest, it's hard for people to look at and suggest change or give up something. So we think that governors can do something more if they have somebody outside look at these programs. We're recommending that they look at the function, whether or not they have a state advisory council, where it's located, and how functional it is. Is it meeting the requirements set forth in the statute that authorized it, and that was the Head Start reauthorization bill. Again, looking at the Head Start collab offices and where they are they co-located? Every year, HHS gives the states a certain amount of money to run those offices on, and the degree to which they're meeting the requirements in the law needs to be looked at, and you'll see that we make a recommendation to Congress on this one also. Then licensing in QRIS, we think it's important to ensure that licensing is the foundation for QRIS. That's only happening in a handful of states in this country. But when you have 2 systems going, it becomes really confusing for child care providers out there and for parents to understand what these things mean. Continuing on for governors, we suggest that governors look at coordinating their monitoring of these programs so that they are not duplicating in this area. This is very confusing to providers who have as many as 10 or 12 inspections a year. We're recommending a unique ID so that we can begin to look at how many children are getting served by these programs. There are some places around the country that are looking at this, and we know that Child Trends has done a lot of work on this and the data integration system, and we really support that work to get better data systems and unique child IDs out there. And then lastly, for the governors, we really think governors need to get out there and listen to some of the families and have families describe what they're experiencing. We were talking before the webinar started today about the situation that happened in New York recently with families waiting, in a waiting area for child care subsidies. And it's an important thing that people look at that. So at the federal level, moving on, we recommend that the HHS and the Department of Education reinstate the Federal Interagency Policy Board that has been co-chaired by HHS and ED and was actually called out by GAO as a good thing. We want to see that reinstated at the federal level. We think that we need to do a lessons learned review of the early Head Start Child Care partnerships, especially those that have occurred at the state level, to identify barriers to aligning these programs. We think there's a lot of lessons in there. We want to look at the TA. We want to recommend TA to the states, that the federal government can help states with this administration and governance by providing TA. And I think this needs to be a special kind of TA that is more focused on the business aspects and the alignment of these programs. And finally, we are recommending that someone look at the past federal grants, including the Race to the Top Early Learning Challenge and preschool development grants, to see what their impact has been on state administration of these programs and the extent to which states are continuing the work once the money ran out. So for Congress, we are recommending that they look at eligibility requirements, that the single biggest barrier out there are the conflicting eligibility requirements, and that there can be some things done to fix that. That we look at Head Start flexibility when it comes to programs between Early Head Start and Head Start, and call for a provision that would allow a Head Start grantee to move the money down to serve younger children without having to recompete. That when states are doing 3- and 4-year-old pre-K, we should be able to move the money down to Early Head Start to serve those children. We are recommending that Congress look at the intersection of Part B and Part C especially. This is really creating havoc for families in some places when Part B is in the schools and Part C is in health or in some other agency. And then looking at the intersection or the system alignment again, and could Congress consider a birth to 5 strategy when it comes to Part B and Part C. Then I think a couple of other things that we are calling for here is requiring all Tanf funds spent on childcare to meet the CCDBG requirements. We've talked about that. And then we're recommending that Congress take a look at the effectiveness of the Head Start collaboration offices, where they're placed, and can we do something to improve them. And finally, let's see, we are actually asking for HHS to report to Congress on the status of SACs and their activities as undertaken in the states in terms of meeting the requirements in the Authorizing Act. And then that GAO take a look at these things as well, because there was a fair amount of money put out during the ARA funds to fund these and get them going and have the states continue that. And then finally, we think that GAO could basically do a study of the state administration, where GAO in the past has focused, as I said when I started, on the federal government. Is it time for GAO to study the state implementation of these funds? Okay, and then finally, I think that we think that, well, both the Congress and the federal agencies they do have some responsibility for this fragmentation and duplication, that really most of the flexibility and responsibility does lie at the state level. And so we are calling on governors, especially those new governors coming into this system, to take a look at this and to figure out how they can move forward and look at this objectively and independently, and see if we can't do a better job of serving our families and our children. We think there's responsibility in a lot of places, but actually the flexibility lies at the state level. So with that, we're going to open it up for questions. I know we dumped a lot of information here in this time period. We hope that you will go to the website, look at the report itself, and look at the individual state sheets. And then, of course, if you have questions or any of that, you can always give us a call here at the BPC or email us, and we'll be more than happy to talk to anyone. So what kind of questions do we have here?
So far our most popular question is whether the slides will be available.
And I should have said that. Yes, they will be. We will post a recording of this on our website, we hope by Monday. So yes, they will be.
Okay. So more topical ones. One is, what are the implications or consequences of not transferring Tanf funds to Ccdf?
Well, depending on whether or not the state, if the state is spending money directly on that, as I said earlier, we have no accountability for that money. We don't know what it's buying us. We don't know what kind of quality the children are in. We know nothing about it. So we basically think that if states can transfer that money in and or ensure that the funding is only going to providers and to programs that meet certain health and safety requirements, I think our concern really is about what the children are getting and the accountability for the funds.
We have another question about whether the issues will be on the early childhood agenda for governors and moving forward in 2019.
Well, we hope so, and that's why we're doing this report, is we wanted to get this on governors' radar screens as new governors come in in January. They have, and I think one of the things that we think here now, after looking at all of this, is that governors really don't know what kind of flexibility they have, and I think that's been our number one takeaway from this, is that in many states, governors assume they can't change this. And I think we're trying to say to new governors and old governors alike, you do have authority here. You can do more to fix this. And we are encouraging them all to pay attention to it.
And in line with that, can you elaborate on how states can align their eligibility without congressional action?
Well, and that's why we make the recommendation to Congress that they look at this. There are some things that can be done, and one of the things that we learned even in the early Head Start Childcare partnerships, there were very few cases where we couldn't work it out, but it isn't always easy, and that's why we do think Congress has a role to play in this. One of the things that helps is the fact that in the reauthorization of the Childcare and Development Block Grant, the 12-month eligibility requirement helps with that, so that children aren't required to reapply, sooner than necessary. But there are issues around eligibility. We've been talking about ideas here, and I think we should all give some thought to what would we like to see happen when it comes to Congress on this issue. We've thought about, should we give a range of eligibility, and I think we put this in the report, serving the lowest income first and then moving up and giving states more flexibility to align within a range so that children don't lose services or get kicked off, and that we can try and work that out. But I think we're open to ideas here, and I think Congress would love to hear suggestions as well.
Mm-hmm. And how will the infusion of the new CCDBG money from the last budget make things better?
Well, I think there's no question that the new money, and we tried in the report, we did call out the new money in a certain section of it, although the data that we based our study on was 2016 data, because that was the last year for which we had consistent data across the program. We did call out the fact that the new money came out recently, and this should help. This should give governors some flexibility now to make some of these changes, actually. But the new money is going to it will help serve more children, there's no question about that. And our hope is that, when all of this, because there's resources right now, that people take advantage of it and try and look at this. I want to keep restating here, though, that in no way do we think there's enough money in early care and education. The argument for many years has been that inefficiency, if the states were more efficient, that they could do this. Well, we know that that's not true. However, there are places where states can improve things for families and probably get more children served. And in those states where they didn't draw down all the money, that's particularly true.
Mm-hmm. And could you elaborate more on how the data were verified for every state? What was the process?
For every state, once we put the pages together for the state, we sent them back out to each state, and we had our contacts in each state verify the data. When there were discrepancies between what we had and what the state said, we had always accepted what the state said. So the sheets reflect the latest that we had from with state concurrence on that, with one exception, and I think I noted that earlier. Vermont decided not to respond on that one. So all of the other states, someone in the state verified the data for us.
And how is the report being distributed to governors and state decision makers?
Well, we're trying to get it out in every way we can, and hopefully those of you on this webinar will help us with this. It will be on our website. We're putting it out through our channels here at BPC. We're going to be working for the next few weeks to get the distribution as far and as wide as we can.
Okay. And then there was a question about whether the report looks at home visiting programs in states. Did that come into the analysis at all?
We did not look at home visiting in this particular thing. We did talk about it, but because of the nature of the grants and understanding, it got too complicated really for us to get into the home visiting as a part of this.
Mm-hmm. And do we have any data or information that tie these scores and structures with coverage or quality or other outcomes for children?
That's a really good question, and it's one that I've thought a lot about. The problem is the latest coverage data we have is what was in the GAO study, and it was based on 2012 data, and there hasn't been any update to that data since then. So we can't really draw any conclusions on any changes or anything like that. We looked at structural issues, not like quality pieces of it. We did not try to judge whether or not they were quality, and I think we said it in the report where we needed to say it. We didn't look at, for example, we couldn't tell the effectiveness of the state advisory councils. We could only look at whether they existed or not. We could not look at what the collab offices were doing. We could only look at where they were positioned and, how they were co-located with other offices.
Mm-hmm. And then there's a question about the lack of recommendations for state legislatures, and was that more because there's a focus on governors that you see it as they're the same line?
Because in the legislation, the agency within the state identified was the governor. And when I said we went back to the authorizing legislation, we looked at, okay, the Congress says this, the governor shall, or the chief executive officer shall. And so that's what we used to say that. And they did not mention state legislatures.
And I just want to, sorry, I should introduce myself. This is Megan Campbell. But I just want to jump in and say you all are submitting a lot of great questions, and some are very specific, and we have a record of them, right? And so we should be able to hopefully, depending on what they are, we can post them, follow up, especially for people who are posting very state-specific questions. And the report does have a lot of detail, and there are state-specific fact sheets on the website that might be able to address some of that.
There's a question on here about did we look at state data on the ESIDs, and no, we did not. We took what Child Trends just released, I believe, in September of this year, and we used their data to look at that issue. And that's true of the pre-K. We also use NEAR's data on that. Okay, we've got a question here. How do you see the trade-off between 12-month eligibility and what some states are doing with waiting lists? I'm not sure I quite understand that one, trade-off. Because the 12-month eligibility is not an option, it really is something, I'm not sure what the trade-off would be there. Okay. We have a lot of questions here, folks, and we appreciate them. And as Megan said, we will try to take these questions and get answers posted on our website for you. Did we look at if states have MOUs between different agencies that administer ECE? No, we did not. There was no way to get that kind of information from the public sources that we used.
And then what about child welfare funding? Did that play into your analysis here? Or?
No, it did not. No, it did not. And again, we started with the 9 funding streams that were identified by GAO. We added to that Tanf and CACFP because those are fairly big pots of money that go to early childhood, and we wanted to look at how they sort of where they were located within the structure, but we did not get into other other funding streams.
Mm-hmm. And I think this goes back to some of the trade-off questions, but we also got a question about the interaction and possible loss of family child care providers with the health and safety requirements.
That's probably a good question, and it's one that we could not evaluate in this report. I think there's been some concern about the decline in the family child care population of late. I don't think that we have a real answer to why that is happening. Some of it could be because of the health and safety requirements. Some of it, I think, also depends on the economy. My experience over the years has been that as the economy and unemployment goes down, there's more jobs and employers are competing for people. So if you can make $15 an hour in fast food, childcare is really hard work. You might be thinking that that's a better option. So I don't think we have the answer to that, and I think this is something that personally needs to get studied, to be honest with you.
Mm-hmm. And then when looking at the QRIS and the licensing, did you identify any states where QRIS is voluntary, but the licensing and QRIS monitoring are conducted by the same staff?
No, we did not look at that. We didn't have access to that information. That's a good question, and it's one that I think should be looked at.
Okay. There's also a question about if, Linda, you will be available to present this information to state coalitions.
That's a really good question. We can have that conversation sometime. Depends on what time of year and what the weather is. Other questions? Let's see here.
Let's see, and then here's Medicaid funding.
Yeah, we didn't really look at Medicaid funding. I think that there's been some interest, and I saw a report come out not too long ago from another group that looked at Medicaid funding for ECE. We didn't look at it for these purposes, but I do think that that's something that deserves some, exploration.
Mm-hmm. And how long did the verification with states take?
Longer than we thought. We actually sent these out for verification, I think, in July, and it took us probably, about 3 months? 3 months to get it all done. It was a long process. We liken it to having, a baby here. Okay.
I think we maybe have gotten.
I think.
Did we look at participation in QRIS, the rate of participation?
No, we did not look at that.
That one's hard to get.
Yeah. I think all of these questions are really good, and they're questions that at some point in time somebody should take on. I think, again, we were limited to publicly available resources, and I think that's where, there are just real challenges, and it gets to some of the recommendations we're making to Congress and to others about why we need child ID numbers, why we need better data systems out there. If governors are asking questions about different things, or legislatures for that matter, they want data, and I have to say that is a challenge for the early childhood field. We need better data, and I think if Qris is on and Child Trends is on, they would probably second that. But it's definitely an issue, and one that we have been making recommendations on. So So I think that that's it. We've got a lot of questions here. We'll sort through them and see if there's anything we missed. We will put some Q&As up on our website to respond to these questions. And of course, you can email us or, give us a call, and we'd be happy to talk about what we did here. We hope that it makes a difference out there and that states can pay attention. If you look at the top 10 states, and a shout out to Montana if you're on the line. But if you look at the states that really scored high, I think they've worked really hard and taken this seriously. And as we were talking about this earlier, they aren't necessarily states with a lot of money. They were states that worked, pretty hard to just be efficient with what they had. And I think kudos to those states. It puts them in a really good position to move forward on a number of things. So we're hopeful that all this will be taken seriously by governors, legislatures, Congress, and everyone else. And we welcome your questions, and thank you all for joining us. And by way of farewell, we hope you all have a very happy holidays. Thank you, guys.
Thanks, everybody.